Hi, everybody. This is Dr. Ann Homza on the Boston College campus virtually from Babst Library. And I'd like to introduce you today to Libby Walton-Stanforth, who is a bilingual school psychologist. And I'll be interviewing Libby. And first, I just wanted to introduce her. So let me share my screen here. So I've known Libby for 35 years or so. And a little bit about her background is that she's a former English teacher in Puerto Rico, and she's been a bilingual special needs teacher in a resource room and in a substantially separate classroom. She's bilingual in Spanish and English. And she's been a school psychologist for a number of years. Libby, how many years?
Close to 20.
Close to 20 years now, and she has been a practicing bilingual school psychologist, first in Massachusetts, then in Florida, also in New York, and now again in Massachusetts. So we invited Libby today to talk a little bit about what a bilingual school psychologist does and to share some information about what's important for classroom teachers and school folks to know about the overlap between bilingualism and special education services and how we can best help our emergent bilingual kids. So with that, we'll start with our first slide. In terms of bilingual school psychologist, Libby, what can you tell us about the training and the roles and the perspectives of a bilingual school psychologist?
So school psychologists in general have training in special education and mental health, behavior, learning in general, measurement and evaluation. And then a bilingual school psychologist should also have expertise in language acquisition and the mental health needs that are more specific to the home language communities that she would be working with. The role really depends on the school system. And I've had a range of different roles over the almost 20 years. Usually there's an evaluation role. It could be the role of testing one-to-one with a student, being a part of an evaluation team, or being involved in the response to intervention process. There's usually consultation with teachers, parents, and administrators working on behavior plans, problem solving, providing school-wide supports. And then sometimes there's direct service to students, which could be like daily check-ins, informal support, or more formal counseling groups or individual counseling on an IEP. There's also advocacy involved, and I think any school psychologist feels like it's important to advocate for best practices overall in education, for always keeping in the front of mind what is the best for the student, the particular student. And as a bilingual psychologist, I feel like that advocacy role is particularly important. I feel like it's my job to help people really look through a bilingual or language learning lens when they're problem solving. And I feel like it's my role to educate people around issues related to second language acquisition. So I also think that a bilingual psychologist or a bilingual school psychologist brings a unique perspective to a school, to a problem-solving team. There is, of course, that bilingual lens, which is very important. But there's also kind of a comprehensive perspective because we are trained in both education and mental health. We're also really trained to look at a child in their particular context with their particular history. So we're not just looking at learning and we're not just looking at behavior. And I know we're all looking at the whole child, but I think sometimes having a school psychologist really helps tie it all together.
That's excellent. Thank you. So we don't have a whole lot of time to talk about emergent bilingual students and emergent bilingual students with special needs and all the various program types, so-called English mainstream classrooms, SEI classrooms, TBE classrooms, dual language, two-way. But what are your general thoughts about such students being educated in and through more than one language?
So I feel pretty strongly that the best way to educate students who are emergent bilingual students who are learning English as a second language is through bilingual education, through a dual language program or through some kind of bilingual education. So I've been doing this a long time. I was a bilingual special education teacher, and I've worked as a school psychologist in several different states and in several different types of programs. So I've worked where there were bilingual programs, and I've worked where there were English only programs and SEI programs. And, it's my observation that it's easier to learn to read in your first language. It's easier to learn a lot of things in your first language. And that native language instruction really supports concept development and vocabulary development, higher order thinking skills in all of the languages that a child is learning. On the flip side of that, I've seen ELL students in all English programs and SEI programs be at a real disadvantage in terms of developing cognitive academic language in either language. And they struggle to achieve grade level proficiency. And because of that, they're at high risk for inappropriate special education evaluations, referrals. And, I think it even impacts the dropout rate. And that they're more at risk for dropping out of school. In terms of kids who have already been identified with special needs, I also think that those kids can benefit from being in a bilingual program and learning through both their native language and English. And I especially think that special education supports, when possible, should be provided in the native language.
That's terrific. Thank you. Can you talk briefly about the idea that emergent bilingual children as a whole could be considered disproportionately overrepresented and at the same time disproportionately underrepresented in special education?
Yes. So there are huge issues in many schools when it comes to referral and evaluation of emergent bilingual students. I think that the overrepresentation piece seems more obvious, and I think it makes more sense to people who are at all aware of these issues, especially when an English language learner is in an all English classroom, all English program. There are learning, behavioral, emotional issues that might emerge in that particular setting that could be attributed to a potential disability rather than the expected and typical process of trying to learn content at the same time as you're trying to learn the language of the classroom. So I think, that is where we get a lot of the inappropriate referrals. And then evaluation practices are problematic for emergent bilingual students. Emergent bilingual students who are not proficient in English don't do as well on many kinds of assessments as their native language peers. And the assessments are comparing them to reference groups that are not made up of their true peers. So they might emerge as particularly, low functioning in a particular academic area when the fact is that they haven't had the exposure to English, or they haven't had the same curriculum, for example, in their educational history. So that's where the overrepresentation comes from. The underrepresentation, it's really important to recognize that bilingual children also can have disabilities, and that we don't want to deny access to all important special education services, especially in the early years when early intervention is crucial for kids who truly have a disability. But that's really hard to tease out because every child is different, and every emergent bilingual's experiences are different. So there are a lot of situations where a school might take a wait and see approach and might say, well, this 9-year-old is not really reading in English, but that's because he hasn't learned English. And that's where it's really important to look at the history and the context and to talk to the parents, because maybe you might find out that that child received great educational opportunities in their native language from the age of 6, and that the parents were providing support for homework every night, and the child never learned to read in their native language, or did so very slowly, and it was a real struggle. That's a child with a reading disability. And the history and the context are super important, and we don't want to deny those kids services. So evaluation becomes crucial, and appropriate evaluation practices become crucial.
Oh, that's so important. Thank you, Libby. So you prepared some very helpful documents, and the first one talks about Massachusetts disability categories, right? And what teachers need to be aware of. So can you please list the most prevalent disability categories? You see them here, right? So why don't you tell us what these are?
So these are the ones, so there are actually 10, I didn't count them, disability categories in Massachusetts law. And these are the ones that I'm highlighting because these are the ones that are sort of most in danger of, kids are most in danger of being categorized into one of these disability categories inappropriately, or potentially denied service and eligibility. Speaking specifically about emerging bilingual students. So communication impairment, health impairment, and with health impairment, that's where ADHD, attention deficit hyperactivity, falls. And so that's why I note that. Intellectual impairment, and then specific learning disability. The other one I would add to that, but I don't see it as frequently, is emotional impairment. There's of course a risk that people are going to view what are perhaps typical responses to maybe a disruptive and difficult history and adjustment period as an emotional impairment, when it is of course just a response to a difficult situation. So that's something to keep in mind, but these are the ones I really see more frequently.
Terrific. So, so let's take a moment and talk about each one of these. I know in your handout, you talk about all 10 of them, and that these are the ones that teachers and school folks in general should really be aware of. So if we could talk about each one individually, I think that's helpful.
Okay, so to start with communication impairment, so I'm going to read a little excerpt from the state definition. This is the capacity to use expressive and or receptive language being significantly limited, impaired, or delayed. And it's exhibited by difficulties in speech, such as articulation or voice, and then conveying, understanding, or using spoken, written, or symbolic language. And this is considered an eligibility category if such an impairment adversely affects the student's educational performance. One thing I want to say before I get into things to watch out for is that if there is, so this is a very, it's a very common category. I'm sure, you know, teachers watching this have students with communication impairments in their classes. If you have an emerging bilingual student, an ELL student who has a communication impairment that is already diagnosed, please advocate for that student to receive services. There are some situations where people seem to think that you can be in special education or an ESL program, or you need all. So a child shouldn't be denied access to speech and language therapy if they're receiving ESL services or bilingual services. So that's something you can do to really advocate for kids who have already been diagnosed with a communication impairment. In terms of thinking about whether a child in front of you might have a communication impairment and you might need to make a referral, and that child is just learning English as a second language, or perhaps even has been learning English as a second language for a period of time. Remember that, I mean, this seems obvious, but remember that a communication impairment exists in both languages. Mm-hmm. So if the child doesn't have communication difficulties in their first language, you know, obviously it is not a communication impairment. But sometimes if you're in an all English school and there aren't a lot of bilingual personnel, you know, how do you know that? I mean, obviously you want to talk to the parents. If you're in a school with a bilingual program, you're in a much better situation. Hopefully there is a bilingual teacher who works with that child and knows that child and really can give you information about that child's communication skills in their first language. You know, I've had the experience where the school will have somebody who speaks the child's native language sit down and have a 5-minute conversation with that child and then tell me that the child has real communication difficulties in their first language. You know, that's not quite enough. I want some more comprehensive information from the parents. And the other thing to remember is that a child who is in an all English program who is learning English as their second language probably isn't developing cognitive academic language in their first language. So they may, in fact, have some real gaps and inconsistencies in their higher level sort of language skills. That doesn't mean it's a communication impairment. They're developing those language skills in English because that's the language of school. And again, if you're in a bilingual situation, you know, that makes that situation much better. Other things to look for, you know, there's a wide range of what is considered typical for a child who's just learning a second language. And some of these typical aspects can be confused with disability. One is, you know, it's expected to have some interference, some transfer from one language to the other. The typical example of that is in Spanish, a Spanish speaker saying it in English, the house black, putting the adjective after the noun, because that's the typical construction in Spanish. That's not a disability. That's a typical aspect of language acquisition. Another thing that is typical, I think everybody knows about the silent period. but when you're looking at a silent period, remember that that's going to be different for every child. That depends a lot on, again, the child's context, the child's situation, the child's personality, the child's level of anxiety, the child's opportunities for practice in the language. So that can really vary. Another thing I think most people probably recognize, that code switching, switching back and forth between two languages, even within a sentence, is also a typical process for people who speak two languages when they're in their bilingual community. Another one, oh, go ahead.
A minute. That's a really important one, because that whole notion of translanguaging, right, is in feature of kids who grow up in completely bilingual environments. So it doesn't really suggest any kind of communication impairment. This is how language works for them because they're growing up bilingually that way.
It's typical.
Really typical.
The typical process, yeah. Another one is language loss or attrition. Again, this is not as big a problem in bilingual programs, but if you're in an all English situation, you know, as I said before, you really can expect that certain aspects of the first language are not going to continue to develop. That's not a disability. That's unfortunate, but it's not a disability. And then I think, as I mentioned before, you know, gaps and inconsistencies in either language. Kids are coming to us with a real range of educational experiences and language experiences. So then importantly, reasons to suspect a communication impairment: history of speech and language delays, not meeting speech and language milestones, especially lack of babbling, current concerns reported by the family that they still struggle to understand, that this child in the comfortable home situation really still struggles to express himself. A positive family history of communication disorders and learning disorders. You've got to take a good history because it runs in families. This is very hereditable. Other things that, again, you're really going to have to talk to a bilingual person who works with that child or the parents to ask questions about how they express themselves. Do they use precise words for things, or do they use a lot of words like stuff, things, you know? That can be a real tip-off if that's occurring in a language that they've had access to and that they've been consistently learning. And you're going to see that in English. That's to be expected because they don't have the precise vocabulary. And then another thing to look out for is inappropriate social use of language. So that can also be a tip-off. And again, let's not confuse it with second language acquisition. But those are, you know, I have more, but these are some things that you can look at that might tip you off.
Super helpful, Libby. I'm really thinking about our teachers who are in the dual language two-way situation where they have such an advantage of having, you know, the student going back and forth in that common model of, you know, there's the English side and there's the Spanish side or the Portuguese side, whichever, but they can work together to sort of talk through what are the things that you're seeing, here are the things that I'm seeing, you know, and that in sort of combination with the family history, right, is going to give you a best picture about, is this actually some kind of disability, or is this more sort of what we would expect for a child who's growing up in a bilingual environment?
Yeah, and you may see different things, you know, from the two teachers and in the different language situations. So yeah, that's super important, and what an advantage.
Terrific. So let's move on, if we could, to the next one, health impairment.
Okay, so
all health impairments, but really with your focus on.
Right, on attention deficit hyperactivity disorder. So in Massachusetts, a health impairment is an acute or chronic health problem such that the physiological capacity to function is significantly limited or impaired, and results in educational, adversely affecting the educational progress. It can include health impairments due to asthma, attention deficit, hyperactivity disorder, as well as other health conditions. So one really key aspect of that is if the health, and this is a special education category that a child would qualify for if the health impairment adversely affects the student's educational performance. So for students with attention deficit hyperactivity disorder, they may be making fine educational progress, but they may require certain accommodations in order to fully access the classroom. And if that is the case, special education is not the service that is required. Special education in Massachusetts means that somebody has a disability, it significantly impacts their educational progress, and they require specialized instruction or related services. So there are some children who may have a disability, such as attention deficit hyperactivity disorder, where they can receive accommodations, and those may need to get written into a plan, a 504 plan, which is a whole other, discussion, but they may not be eligible for special education services. ADHD, currently the psychiatric definition of ADHD involves a significant difficulty managing hyperactive and impulsive behavior, and or significant difficulty with inattention. And so in the psychiatric definition, there are currently 3 subtypes. There is the predominantly hyperactive impulsive subtype, the primarily inattentive subtype, and a combined subtype. So when you think about all of those, and you think about the kiddos you have in front of you who are emergent bilinguals, there are some things to look out for, because there are some things some emergent bilinguals might do that might make them look like they have ADHD. And then depending on the school system where you are, you might do a referral for special education, or you might suggest, to the parents that they go talk to their pediatrician or something like that, depending on the school system and how attention deficit hyperactivity is diagnosed. But one of the core, presentations of ADHD is that they zone out, that they don't follow directions, that they, kind of lose their place in a big, whole group lesson. And when you think about an emergent bilingual, especially somebody who's really just learning English, of course they're going to zone out. Think about how difficult it would be to learn in your second language for an hour, never mind all day. I zone out when everything is in Spanish. I'm not always paying attention. So I present as disorganized too, probably. So all of those symptoms, that we might attribute to ADHD, those really could just be attributed to not understanding what's going on in the classroom. The other thing is, the hallmark of the hyperactive impulsive part is that we see a child as fidgety and restless, who requires a lot more movement than other students. And I think especially for young students who are learning in their second language, they get really tired. And so not only might they zone out, but boy, they may need a little break, and they may get fidgety, and they may require some extra breaks and some extra movement. So those are the things to watch out for. The things to really suggest that ADHD is, is truly a possible diagnosis are a strong family history of ADHD and strong input from the family that this is a child who has, quote unquote, always, been hyperactive, has always experienced significantly more difficulty in areas of inattention or hyperactivity and impulsivity than their true peers, their siblings, their cousins, other kids in the community. And the other thing is that if these symptoms are only seen in the classroom, then it's pretty clearly not ADHD, because ADHD happens everywhere the child is. ADHD may manifest itself differently in different situations, but you're gonna see it. So they're gonna see it at church. They're gonna see it in the community when they go out shopping, and they're gonna see it at home. So, that's just a little glimpse in terms of ADHD.
Terrific.
So then, you're welcome.
I'm sorry.
So then let's go to intellectual impairment.
Terrific.
Okay, thank you. So intellectual impairment is the permanent capacity for performing cognitive tasks, functions, or problem solving that is significantly limited or impaired. And it is exhibited by more than one of the following things: a slower rate of learning, disorganized patterns of learning, difficulty with adaptive behavior, and or difficulty understanding abstract concepts. That's the Massachusetts definition. The psychiatric definition, according to DSM-5 right now, the key features are that it is a significant impairment in both global intellectual ability and adaptive functioning, and it is apparent before the age of 18. It's usually diagnosed with an IQ score that is at least 2 standard deviations below the mean, as well as an adaptive behavior scale that is 2 standard deviations below that mean. What that means is we're talking about a very significant impairment. It's not a super common impairment. Kids who are emerging bilinguals historically have a very high risk for overrepresentation in this category. And when you think about it from the perspective of monolingual school personnel who do not speak the child's first language, a child who is just learning English may present as low functioning, as slower to learn than peers. I think that most of us don't present as our brightest selves in our second or third or fourth language necessarily. And then the actual ways that we evaluate kids are problematic as well. Even when assessments are given in a child's native language, any verbal assessment is likely to be an underestimate of an emergent bilingual's verbal ability. And so that would make any test that incorporates a verbal scale not a fair assessment. We also, in intelligence tests, we rely a lot on what is called crystallized intelligence. And crystallized intelligence is the learning, I mean, it's more learning than intelligence. It is our broad range of knowledge. It's our vocabulary knowledge. It's what we learn in school. So one of the reasons why even evaluating a child in their native language on a verbal scale, that has a significant role for crystallized intelligence, is that the kids we're assessing oftentimes have a very different educational history than the kids these tests were normed on. So we're comparing a kid who has maybe learned a whole bunch of other things to kids who have learned the things on this test. So this child will come out as significantly lower than this child's peers on that test. So then, you know, another issue is, how about all nonverbal tests? Okay, well, that's better, but it's not perfect. And it's not perfect because what if a child has a specific learning disability that is tied to something you're evaluating on the nonverbal scale? What if their strength is actually in the verbal area, even though on this test it's not going to come out as high as it might for their peers? So it's really tricky. It's really tricky. So if you are considering a categorization of intellectual, or if a team is considering the eligibility of intellectual impairment, you do this with tremendous care. And you need comprehensive information from multiple sources. And history is crucial, and input from the parents and the home setting is crucial. Don't just give a behavior rating scale or an adaptive behavior scale to the teacher. You need to find out how this child is functioning in a culturally appropriate way in the home setting. And that's a whole other can of worms, the adaptive behavior scales. Because are they assessing behaviors that are culturally appropriate? So I'm not giving you a lot of good answers for that. I'm just saying you got to be really, really careful.
Thank you, Libby. Thank you.
You're welcome.
Because this is one where if there's such over-representation historically, you know, it really affects these children's life paths, right?
It absolutely does. And by the same token, if a child genuinely has an intellectual impairment, there are services that can be accessed through the lifespan. That will be important. Yeah. So we've got to do a good job. We've got to really, and the key to a good job is history and parent input and community input and culturally appropriate practices.
Right.
Yeah, it's important.
And push back against those test scores that don't.
And push back. Yes, please.
Thank you. So I have one more category, is that right?
Mm-hmm. Yes.
About specific learning disability, which I understand is a category.
It's a big category. It's a big category, and this is the one that we spend an awful lot of time on. Most kids who I evaluate are being evaluated. The question is whether or not they have a specific learning disability. So first of all, let's look at what a specific learning disability is. A specific learning disability is a disorder that adversely affects the development and the use of specific academic skills, such as reading, writing, and math, and is unexpected because other aspects of learning and development are within the average range. There is a lot of emerging research in the field of specific learning disabilities, and the field is changing and moving. And the determination factors in Massachusetts are what they are, and we need to follow them, but they are different in other states. So the traditional way to determine a learning disability in Massachusetts and a whole lot of places was to look at a significant discrepancy between a child's measured intelligence on an IQ test and their academic performance on an achievement test. In some states, in some places, you also needed to have proof that there was, or documentation, that there was some kind of a processing disorder that aligned with the particular achievement difficulty that they had. In other words, working memory difficulty. Well, that makes it hard to learn to read. That makes it hard to learn to do math. Massachusetts has added response to intervention to achievement ability discrepancy as a determination factor. So in Massachusetts, you can be determined to be eligible for a specific learning disability if you have been, if the school has provided a very, I want to say, comprehensive response to intervention program, and that it has been well documented. The great thing about response to intervention is that children who are emerging bilinguals are not just plopped in a classroom, and when they don't do well, people say, well, we'll see what happens in 2 years. And then they refer to special education. It's fantastic because people are already looking at potential interventions. They're getting small group help. So they're really doing things to try to solve the problem and try to increase the child's performance in whatever the area is. What's tricky about that is that if you're using RTI as a determination for eligibility for a specific learning disability, a child who is just learning English and is being given their intervention in English isn't going to respond to the intervention in the same way that their native English speaking peers are going to. So a child might look like they have not responded to the intervention, they have not responded to the intervention, and then, down the road to specific learning disability, which might be inappropriate. But then, you've got the issue on the other side with the achievement ability discrepancy, where you have these evaluation factors of, you give an IQ test, the child doesn't do well in the verbal section of the IQ test. Oh, guess what? Does not have average intelligence, therefore can't qualify for a specific learning disability, even if there are a lot of historical factors, involved. So there are issues with both of those. But let's, and the other thing I wanted to say about Massachusetts is one really great thing that Massachusetts has done is you have to do a lot of paperwork in order for a student to qualify as a child with a specific learning disability. And two of the things you have to do are very important. You have to complete a historical review. And of course, in any good evaluation, you're going to complete a historical review, of course, but this mandates it by law. So you have to look at how the child has done throughout their educational history. The other piece are the exclusionary factors. And one exclusionary factor is that you cannot say if the child's difficulties in learning are completely due to their second language acquisition. It says right there, it's not a specific learning disability. So that's a protection. And then the other protection is that it cannot be primarily due to, they say, lack of educational opportunity or experiences. I would say different educational opportunities and experiences. So just because this fourth grader doesn't know how to multiply doesn't necessarily mean they have a learning disability in math. Maybe in the curriculum that they were taught in, they haven't hit multiplication yet. So, so those are great because those are protective factors. The thing is that you can be a second language learner and have had a very different educational experience and still be a learning disabled student. So we have to figure out, when is it that we're going to suspect a specific learning disability, and when teachers might think they need to make a referral or at least look further. Number one, positive family history of learning disabilities or learning problems. And for people who are coming from different backgrounds, it might not have been special education or a diagnosis. It might have been, yeah, I never learned to read. Or, you know what, math was always so difficult for me. So you've got to really interview the parents, and you've really got to get, you've got to probe a little bit. History of delayed or disordered early language development is very strongly related to later emergence of specific learning disabilities. Input from the family that this child has had significantly more difficulty in this aspect of learning than other kids in the family, other kids in the community, cousins, etc. And that the child, in spite of perhaps good instruction, always struggled with this and didn't struggle with other things. So maybe in a third grade classroom right now, that's all English, the kid looks like she's doing the same in English and math, but maybe the parents will tell you, but no, because in Puerto Rico, you know, she did great in reading and writing and expressing herself. She's always hated math. It's always been a problem. So that history is going to really tip you off. The other one I really want to say is lacking basic phonological awareness and phonics in the native language, in spite of good educational opportunities in that language. So I wouldn't expect a child who never had those educational opportunities to have developed those skills. But those are directly related to a specific learning disability in reading. And if that has been occurring in the native language, I would be concerned. It's also among the first things to develop and the easiest things to develop in a new English learner in terms of reading. So if you are giving the kid lots of instruction in phonological, meaningful, comprehensible instruction in phonological awareness and phonics, and the child is struggling in that, maybe more than like vocabulary development and comprehension, that's a tip-off. You know, how'd that child get so good at vocabulary development and comprehension, but they're having trouble with these very basic skills in reading? And so that's a tip-off. Same thing with math skills. Those basic math skills, if they're struggling in spite of comprehensible and consistent instruction, then, you know, that's something to watch for. Okay.
Terrific. Thank you. So that was awesome. And I think that teachers will find it super helpful to be able to go back to that handout and sort of say, you know, what is it again that I need to be aware of? What should I be looking out for? And this has been super helpful, Libby. The other wonderful handout that you provided for people was this list of inclusive practices. So we're not going to have time to sort of go through all of these at length, but if you could just give us these, you know, kind of highlighted that you prepared for us.
So basically I've divided it into 5 sections. So the bottom line is all teachers in all classrooms will have students who are struggling learners, who are emerging bilinguals, who are students with disabilities, students who just need a little support. And we are trying very hard to increase our toolkit of inclusive practices. So on the document that I'm providing with you, I listed a bunch of evidence-based core effective instructional practices. I put evidence-based in quotes because they're not usually based on evidence with emerging bilinguals or second language learners. So there is a tremendous body, though, of research about effective core instructional practices. So what I've done is I've listed the ones that are kind of particularly applicable for students who are learning a second language. And again, this, this works if you're in a dual language program, right? Because students in, the English part who are native English speakers, when they're in the Portuguese instruction, some of these might come in handy for that. Then the next section is recommended core instructional practices for English learners and emergent bilinguals. These are very specifically geared for kids who are learning in their second language. Again, that could be applicable to a dual language situation. And this is the basic core instruction they need to have. And if they're not receiving this basic core instruction, they're not going to learn as we're expecting them to learn. And one of the basics for that is explicit ESL instruction for an extended period of time. Others are things like early explicit and intensive instruction in all aspects of reading, things like that. And there's been research on what works with EL and ED students, so that's important. The next section is universal design for learning. This is all about including all students. These are approaches that make learning accessible for all students. So students with disabilities, students with all kinds of disabilities, students who are learning the language of instruction, students who are maybe just struggling in one little area, students who are a little disorganized. These are things that teachers can do, and I think teachers mostly know how to do, and sometimes just need a place to look and say, oh yeah, I remember that, that's a good idea. There is a huge body of resources about this on the Massachusetts DESE website. I actually took a course through the DESE website, a free course, about inclusive practices, and they spend a lot of time and they have a lot of resources about ideas where you can sort of evaluate an assessment to see if it's accessible. It's very, very helpful. So I recommend going to that resource, which I put in my list of resources. And then the next section is specific accommodations for the classroom. So if you have a child with ADHD in your classroom, have a child with a reading disability in your classroom, these are some specific accommodations that that child might benefit from. And then finally, the last part is just guidelines for tier 2 and tier 3 interventions for second language learners. There's not a lot of research, but there's a little bit of research. And this is very specific to reading and to small group tier 2 and tier 3 interventions for kids who are struggling with reading and who are learning to read in their second language. So I'm hoping that can be helpful. One thing I want to say about tier 2 and tier 3 interventions, as I said before, RTI is great for emergent bilinguals. It's great for second language learners, but it's not a one-size-fits-all approach. And what works for native English speakers might not be, in tier 2, might not be what works for an English language learner in tier 2. So I hope that you can just use that. Again, you probably know all of these practices, but maybe having them in just one place might make it easier to pick and choose what you need.
Terrific. That's awesome, Libby. Thank you.
You're welcome.
The last question I have for you, we kind of laughed a little bit when we talked about this before the recording, is, if you could have a dream team in your school to help you figure out, why is a kiddo struggling, Is it a disability? Is it something else going on? Who would the people be on that team to help you figure out? So why don't you tell us a little bit about who would be on your dream team and why these people are important?
So I, of course, have, picked a dream team of many bilingual professionals because it's my dream team. And I'm dreaming that I have a lot of bilingual professionals in the school where I'm working. So in that ideal scenario, I would of course want a bilingual teacher because you need to know what's going on in regular bilingual classrooms. I would certainly want somebody who is a real expert at English language acquisition in general, the ESL specialist. It's important to have a bilingual special education teacher because that's somebody who knows not only all of these disability categories, but also knows what works, has experience working with kids with various disabilities. And likewise with the speech and language pathologist. Bilingual school psychologist, I feel always quite useful. And specifically because, again, some of that knowledge about disability categories and what works, but also being able to contextualize things and to be able to see things from different perspectives and tying it together. And then super important, if we're looking at a school-based team that's trying to increase equity around these issues, I would want a parent or parents from the home language community. And then if the administrator were bilingual, wouldn't that be great? But I at least want an administrator, because you've got to have an administrator because they control like the purse strings and that allocation of resources. But you want somebody who's really knowledgeable about these issues. You want somebody who knows about bilingualism, multiculturalism, and equity. You want somebody who is familiar with the community, the school is working with. And then sort of extras, if you could, I once worked on a team with a bilingual social worker. It was so wonderful. So that would be a great person to have on a team, and a guidance counselor also looking, focusing in on social emotional needs, behavioral issues. If your dream team can't be bilingual because everybody in the school, except for, I don't know, one or two people, only speaks English, all of these people have to be knowledgeable about bilingualism, multiculturalism, and equity. And for a teacher, if you don't have a bilingual teacher, I would want a teacher who has a lot of experience and knowledge about working with second language learners in their classroom. That's going to be really important. So good luck to you in developing your dream team.
That's right. I just want to, I know our time is running out, but I wanted to you had talked so much about the history. It's so important when you're thinking about, all the different disability categories. And sometimes the bilingual school psychologist does the history, but sometimes it's the social worker who might do the home visit, or it's not generally the teacher. The teacher has a lot of information just from listening to parents and maybe doing home visits, but in general, isn't it the school psychologist or the social worker who would do that deep history?
Yes, absolutely. And so in a school system where I used to work, where we had the bilingual social worker, absolutely, she did that piece. Yeah. But I couldn't do my evaluation without that piece. So the communication between professionals was crucial. So even if a special education teacher perhaps was doing the academic testing and I was doing a different kind of testing and she was doing the home visit, there had to be constant shared information. And teachers do often have a lot of that information because, as you say, they've listened to parents. But no, somebody needs to go and delve in deeply and do a real home-based interview. Whether you're sitting in the home or you're on Zoom or even on the telephone, you really, really need to get comprehensive information.
Terrific. Thank you. Thank you. So I hope everyone who's watching this starts thinking now about who you want on your dream team and how you're going to get them there. So important for equity issues. So Libby, I wanted to thank you so much for your time and your expertise. I know that you have so much to share with people, and what you've given us today in terms of your handouts that you created and going in depth in some of these areas in terms of helping teachers be more aware, I think it will really have a great benefit in their classrooms. So thank you so much. And as always, it's a pleasure to see you.
My pleasure. Thank you so much, and good luck to everybody.